All right. Good morning, everyone. Thanks for joining us today. I know the end of the semester, graduation quickly coming up, and a number of interesting seminars and symposiums and poster presentations taking place this week, next week. They're at the end of the semester here, but very pleased to have you all with us today. And we have some particularly incredible folks joining us as well. So our first presenter, Dr. Ethan Hunt, Assistant Professor in Health Promotion and Behavioral Sciences at UT Health Houston School of Public Health. Dr. Hunt completed his Ph.D. in exercise science at the University of South Carolina's Arnold School of Public Health in 2021 and was the Michael and Susan Dell Center for Healthy Living 2021-2022 Post-Doctoral Fellow. Ethan's research interests include childhood obesity prevention and health disparities. Dr. Hunt has also begun to examine the impacts of trauma, particularly adverse childhood experiences, and how adversity impacts child health outcomes. Please welcome Dr. Ethan Hunt.
Thank you all. I just messed up sharing, so give me 1 second. I was trying to move my face around. Can you all see my slides?
We can.
Okay, sounds good. All right, great. Yeah, so thank you. Thank you for the introduction. I'm right down the street at our new building on San Jacinto. So the new building is great if you haven't been able to come in and see it. I'm in the Department of Health Promotion and Behavioral Science. So please reach out and we'll come give you a tour whenever y'all are around. And I've known who Dr. Stephen Russell is for a while, but we actually just recently met in San Diego at another conference. So that's how this all came together. So I'll talk about that a little bit because that's some of the data that I'll be using. So today I'll just talk about some of my current and future research regarding adolescent health. I look at different contexts around adolescent health, structured activities, physical activity, sleep, and more recently, early life adversity. So just to get everyone on a quick introduction here. Yeah, my background is in obesity and obesity prevention and in child and adolescent settings, specifically school settings and school serving or youth serving organizations. So as you all probably know, we do have an obesity health concern here, specifically within the US. Our adolescent obesity rates remain high. 1 in 5 adolescents are classified as obese, and that's just the classification of obesity. We still have overweight as well. So we're more than doubling that number with regards to examining, overweight and obesity in children and adolescents. Because of this and our obesity epidemic, we have place behavior recommendations, and most of you, if you're in this space of physical activity and obesity, you probably know we have these behavior recommendations in place. And in that, we recommend children and adolescents under 18 engage in 60 minutes per day of moderate to vigorous physical activity. We recommend that children and adolescents have no more than 2 hours of non-school recreational screen time. And as you all probably know, that is incredibly difficult to meet that recommendation, even as adults. And we know that adequate sleep is vital during both childhood and adolescence, with recommendations of 9 to 12 hours for children aged 6 to 12 and 8 to 12 hours for adolescents aged 13 to 18 years old. So that's really my, classic. That's how I was trained in my research trajectory, and it's changed a little bit, but I'm going to go ahead and talk about some of this work that I've currently and just recently finished up. So within that, we have a public health challenge. We know that adolescents specifically fall short of meeting those guidelines for physical activity, sleep, and screen time. Despite these recommendations that we've put in place, less than 10% meet the combined recommendations for physical activity, screen, and sleep, highlighting this significant public health concern. These behaviors are independent, they're influenced by different contextual structure, external disruptions, for example, COVID-19, which I'll talk about a little bit, and early life experiences. So a lot of things go into, an overall model which influence children meeting these behavior guidelines, children and adolescents. And finally, to provide some final context, Over the last, almost 2 decades at this point, we've known that obesity and obesity prevalence has been an issue, but trying to narrow down, when obesity and we see these spikes in the prevalence of overweight and obesity among children and adolescents. So this was more of a seminal paper from Dr. Paul von Hippel over 10 years ago at this point. He leveraged the ECLSK data set to examine when obesity was occurring essentially. And we see here on the right highlighted in yellow, those yellow bars are represented in summer, and the non-colored bars are represented during a typical school year. And you see, yes, specifically with like mean BMI, it does continue to go up, but you see a sharper trajectory during that short, classically 3-month window for U.S. children during summer vacation, in which they're not enrolled in structured activities. And I've worked in a lot of schools, and we've schools have always gotten a bad rep for being unhealthy environments. But when you really compare a school setting, even a public school setting, to that 3-month time period in a child's summer when they're potentially not enrolled in any sort of structured activity, we see that schools are even protective on the bottom there, that prevalence percentage. We've seen in this paper showed, and among others have showed since then, that schools are protective in protecting them against increases in the prevalence of overweight and obesity. So it's quite amazing that you can see all this negative weight gain during a calendar year with just that 3-month window. So again, we know that across most school-age populations, weight gain and prevalence appears to be occurring most rapidly during the summer months. Um, a close colleague of mine who is now at the University of Central Florida began to examine this further during his PhD and since, and he was working to understand why that is occurring. And he came up with this idea that we now call the structured days hypothesis. And it really posits that, you know, schools or school-like environments, they play this protective role against the onset of unfavorable health outcomes. In this case, in the case that he had specifically focused on, regulating obesogenic behaviors. That's physical activity, sleep, sedentary time, screen time, etc., through just being enrolled in daily structured regulation and compulsory components. So within the last decades, we've identified summer as this time period where this happens, and this hypothesis really helps drive that idea home that simply schools are, in fact, potentially doing a good job when you're comparing it to that 3-month summer vacation, of which there's potentially no regulation in a structured environment in most settings. So if we think about COVID, especially within school-age youth, at its most basic level, at best, it's simply just removed youth from these structured settings, right? And at worst, obviously, way different settings. But at best, it just simply removed them. So we had these ideas of what we consider, potentially prolonged summers and prolonged non-structured settings for children and youth. So this is a project that I recently completed. Where I examined physical activity and sedentary behavior during COVID-19, before and during the COVID-19 epidemic, from a large cohort study. So I wanted to examine how COVID-19 impacted physical activity and sedentary behavior. And we wanted to assess these differences during structured settings, that i.e. school year, and unstructured summer periods as well. So I utilized the ABCD study, which I'll talk about here in a second, from their 2-year follow-up data. And within that 2-year, it's one wave, but it's such a large study that, this is a rolling data collection. So it was almost 2 years of data collection to have that 1 year of the 2-year follow-up. And this was objectively measured, Fitbit charge, wearable devices up to 21 days. Children or adolescents at this point were wearing those devices. So we looked at steps, MVPA, and sedentary minutes. So just to briefly highlight, what the ABCD study is, and this is where I met Dr. Stephen Russell, because he is on an external advisory board within the ABCD study. So it's one of the nation's largest long-term study. It is the largest long-term study on brain development, funded by NIDA and the NIH. Baseline, they enrolled almost 12,000 9 to 10-year-olds, and at this point, the newest wave, whenever it gets released, those 9 to 10-year-olds are now 16 to 17, graduating high school. 21 research sites across the U.S., annual and biannual assessments through now extending through early adulthood. For the data that I'm interested in, they have wearable device data, sleep, where you can examine sleep, physical activity, sedentary behavior, different cognitive testing measurements, and lots of socio-demographic, mental health, and environmental factors measurements. So really what the ABCD study has done is, it allows us to study development from this rich and longitudinal context, provides infrastructure for us to study behaviors at scale across time, geography, and context. So these are our 21 sites from the ABCD study. And this I found from this first project that we're talking about. It was essentially a time-interrupted series examination. You'll notice the vertical dotted line there towards the right that says the COVID restriction date. What we were able to do is find a somewhat average date of when most COVID restrictions started. Again, more conservative or southern states had different timelines in comparison to more liberal states. So this is just an average. Essentially, end of March is when we kind of aggregated when most shutdowns began across the US. And we were also able to overlay, this is multiple cross-sectional data. So these are not the same kids. Remember, this is just year two, but we were able to just put everything together to look at it in this fashion. And you'll notice I highlighted the pre-COVID summer 19 there in that first highlighted bar. And just like that previous paper that I showed you, we see these dips in overall physical activity. And then it kind of comes up during your school year for the most part. And then we see rapid dips when COVID-19 really started. And then we lost data at that point as well and kind of came back up once kids were wearing Fitbits again. So this essentially just highlights the fact that removing kids from structure, whether it be from summer vacation or the COVID-19 restrictions, simply impacted obesogenic behaviors, in this case, mean physical activity, mean moderate to vigorous physical activity, excuse me. So what we really concluded was, yes, we see a significant decline in our steps, which I didn't show, and in VPA during the pandemic. Also, sedentary time increased as well, specifically during structured school months. Boys experience greater declines in physical activity compared to girls. And we really wanted to highlight here that the double burden, essentially what we call the double burden of summer and COVID-19 disruptions, further reduce our daily movement among adolescents. And there's been other studies that have confirmed that following the COVID-19 epidemic. So really just, it was a nice paper for me to add to essentially the literature base talking about structure, as well as introducing this idea of an additional disruption in the COVID-19 epidemic. So my next project here that I'll try to get through quickly to leave time for questions is understanding early life adversity and adolescent sleep out. This has more recently become a research trajectory for me, a bit of an evolution integrating this early life adversity. So my initial research focus has been on adolescent sleep behaviors, like I mentioned, sleep, physical activity, and outcomes such as obesity. But I worked in a lot of school settings throughout my training, a lot of schools throughout the South and South Carolina and the Midwest. And, I just came to recognize that, we were really pushing physical activity, sleep, nutrition among the schools. But I started to recognize that, what I would consider more upstream exposure, such as adversity, especially among our most under-resourced schools and youth, appears to be such a key driver to behaviors and outcomes. And we probably know that at some level, but it was really apparent to me when I was exposed to a lot of different school settings. So it shifted my work slightly, not really a shift, but more of a combination to look at adversity as well as these health outcomes that I've always been interested in, and those subsequent health trajectories. So this particular project looked at early life adversity and adolescent sleep health. And this paper was just published this week, actually, where I was able to leverage data from the ABCD study and examine some of that. So I wanted to examine the cumulative early adversity effects on adolescent sleep regularity, circadian alignment, using the over 11,000 kids from the ABCD study. So my main exposure, I've been interested in ACEs in the past, the classic 10 ACEs, but in particular, this study looks at the pediatric early adversity and related life events, which takes ACEs and adds some additional measures as well. And I'll show those in just a second. And I categorize these as, the exposure of 0, 1 to 3, or 4 or more adversities. Now we looked at weekly sleep loss, social jet lag, which I'll explain here in a minute, and sleep midpoints between weekdays and weekends. So with regards to our early adversity, we know about this classic original ACEs framework, and, and we can find this data within the ABCD study too. But I wanted to include more upstream factors as well, such as neighborhood violence, discrimination, housing, and food insecurity as well. So, luckily there was a nice paper from Nadine Burke-Harris in California and colleagues where they had done something like that. They took the 10 classic ACEs and started to expand those to look at deeper insights into overall childhood adversity. And we call this the pearls for short. So you'll notice we have the 10 classic ACEs on the left and then an expansion of the seven more, which are a little more upstream um, variables for early adversity. And within the ABCD study set, you can find 16 of these 17 pearls. So that's what we did here within this paper for our exposure. So for sleep midpoint, I've, and if you're on any sort of social media, you see how important people are really starting to talk more and more about sleep within children and adults. This is something that I've been examining since my time as a PhD student, whether that be sleep duration, simply how long you're sleeping, as well as more contextual factors regarding the circadian rhythm, such as sleep midpoint, which we define as simply the middle point between sleep onset and sleep offset. So between going to bed and waking up. So, for example, here, if you typically fall asleep at 11 and wake up at 7 on your workday, your sleep midpoint is 3 a.m. On free days, if you fall asleep at midnight, so shifting, going to bed a little later, waking up a little later, your adjusted sleep time is in 4:30. Therefore, you have a social jet lag of an hour and a half in this particular example. So, and we do know from the literature that social jet lag of greater than 1 hour across children, and now we're seeing this in adults as well, so a greater shift on your weekday in comparison to your weekends, independent of sleep duration, is associated with health outcomes. So it's like you kind of almost have to do everything with sleep duration, with sleep health. You have to sleep the right amount of duration, and you have to hopefully be in alignment from a circadian rhythm perspective, and keep that consistency on the weekdays and the weekends. And then we looked at weekly sleep loss here, which is comparing your sleep duration on weekdays and free days. In this case, work days being considered school days for children and adolescents, and free days being considered weekends. So this is the first paper in the ABCD study to look at pearls. Again, we had 16 of the 17 within this sample, and we just categorized them both linearly, continuously, and categorically. And in the ACEs literature, you start to see effects at just two ACEs with regards to specific health outcomes. So this just looks at, I just wanted to highlight, what different thresholds could be for the pearls, whether it be two, three, or four, and just look at the distribution. 1 in 5 kids are experiencing two pearls within this data set. And if you look down at the categorical version, 33% of our kids in this study are experiencing four or more pearls, which to me is an incredible amount of adversity for a sample that is technically not nationally representative. It skews white and higher income. So if we're seeing these numbers from a somewhat more well-off overall sample, I'd love to see the distribution of this from a nationally representative sample. What we would expect, we'd probably see higher numbers of adversity within a nationally representative sample. And this is pulled directly from the paper. We have our sleep midpoint here on weekdays and weekends. And our first, just looking at the overall sample, we see a shift of, almost 2 hours of a shift in our sleep midpoint, which is exactly what we'd expect within this sample. At least 2 hours of social jet lag right there. That's mentioned right here. And then again, just looking at the percentage of those who have greater than 1 or 3 hours. So again, your cutoff for where we see negative health outcomes is essentially 1 hour of social jet lag. And almost all of the sample, 80%, almost 82% of the sample are experiencing more than 1 hour of social jet lag. So really highlighting shifts. And if you have kids, especially if you have adolescent kids, you've probably noticed a shift. And we all have shifts probably on the weekend, but it's something that we should probably start to be concerned with from our own health and our child and adolescent health, with just keeping kids on a consistent bedtime schedule. And this was just a figure I put together that examined the odds of having greater than 1 hour of social jet lag given our pearls exposure. And you'll notice throughout boys, girls, and the overall sample, I'm more interested here in the four or more pearls. So that's on the right side of each column. You see almost, kids who have four or more pearls are almost 3 times more likely to have greater than 1 hour social jet lag, and that was consistent across both boys and girls. So you're really seeing this highlight the fact that, yeah, early adversity is certainly associated with more sleep disruptions or a more inconsistent sleep consistency and compared to those kids or adolescents with less pearls or less early adversity. So just to share some overall takeaways, this is something I've worked on for a long time, and I'm starting to expand this idea of structured environments to go beyond just looking at obesity and obesity contributing behaviors. I think just getting children and adolescents in structured environments can be protective across many, many outcomes. We also found that adversity leads to this biological disruptions in our sleep. Health behaviors are interconnected. Certainly, physical activity, sleep, and screen don't operate in isolation. And just some policy and program implications. I do think we should think about trauma-informed care, which has become a kind of a hot topic in specifically school settings in the past years. It's a very broad term, so really starting to understand the contextual factors around that. And, just providing, some of my colleagues at South Carolina, a lot of their intervention-based work is simply just providing programs, whether it be existing programs for the most part. You don't have to reinvent the wheel for children and adolescents. Just get them into programs. We know how expensive they are. That's the hard part about, this particular research line is that these programs are not cheap. And because they're not cheap, certain socioeconomic demographics, within children and families just can't simply afford it. So that is the intervention. It's just how can we get more children into programs? And I'd like to acknowledge, especially for that second paper, I am part of the an ABCD START program. It was just a professional development program where I actually ended up meeting Dr. Russell. So it's provided me some advanced training in longitudinal data analysis with regards to some of the work that I've done. And I did want to mention, most of the work I was going to share today is not what you saw. We know that due to current executive orders and policy changes, the current or most recent release of the ABCD study, which is going to be that 6-year follow-up, 16 to 17-year-olds, has been delayed. It was supposed to get delayed or released in January, and then they've had to, as they've done with other data sets, go through and remove items. So we don't have public access to that yet, but that was going to be the original focus of today's talk, talking about some of the work that I've been currently working on within the ABCD data set, which would include longitudinal analysis using the Fitbit data, comparison of obesity and adiposity classifications using their anthropometric measures, and an extended exploration of early life adversity on developmental health trajectories over time. So one day when this data gets released, I will be examining that. But for now, I just wanted to show you some of the most recent work that I've worked on. So I appreciate you. I'm going to unshare here and I can open some time up for questions because I can't see anybody. Okay.
Thank you so much.
Do you have any indication of what, you know, I think we're all on the, in the same bucket here, not knowing what's going to happen when they do, what they're going through the data, but, any indication of whether some of the variables you're really interested in are going to be affected by.
Yeah, so specifically, we don't know. I'm on a couple of the work groups, so I have had an inside track on some of this, with some of the conversations. Yeah, so I am interested in some ideas of discrimination, and we don't know if those variables are going to be in the new release. I do know that this is not my research focus, but a lot of folks do examine, there's a whole section on the gender identity variables, hundreds and hundreds of variables, and those are gone. They've already been told those will not be released. Now, yes, I mean, that's awful, but it's not like they will be there. You just won't be able to use them. So they are hoping that eventually, I mean, we all know that administrations come and go. So they will be there. We don't know when we'll be able to examine them, but they're there. They just will not be available for the public. And that will be the same for anything that they remove from the public releases. So, it may take some time, but at least we can say it's there at some level. But those aren't really the variables that I examine. I am interested in some ideas of discrimination, and we have not been told if those will be in the newest release.
Thank you.
Dr. Hunt, I want to ask you about data about physical activity during COVID. And what do you think explains the gender differences in the non-structured times where the boys were a lot less active? I think that's what the chart was showing. Why do you think?
Yeah, so I know that, historically boys are usually more active, right? And, more recently I've heard whether it be academic or non-academic literature come out with regards to what happened to boys during COVID. I don't know if you've seen some of that from Jonathan Haidt and others that have highlighted that boys were really disproportionately affected during COVID too. Maybe not specifically with regards to physical activity, but with regards to a lot of other outcomes they've talked about how, I had this quote from, I think it was Jonathan Haidt's new book, or maybe someone else, where he was basically like everybody went in during COVID, but for some reason, young boys and young men, they didn't come out as easily as females did. Now, I don't know what that lit where he's citing some of that, but it makes sense, I guess, and aligns with some of the work that I've done where it appears that young men, or especially adolescents, did get disproportionately affected from it. So
Is
I
there any
can't answer
suggest
for sure, but yeah.
is there any suggestion that video games have might be an issue around that? Like
Yeah,
sedentary
I've
time?
seen data before, especially because boys engage in more video game play. And yeah, it just appears that, um, again, it was harder for them to come back out of COVID for some reason. And
Yeah.
that's been highlighted across some mental health outcomes with boys and young men as well.
Any other questions for Dr. Hunt? All right. Thanks so much, Ethan. That was
Thank you. Appreciate it.
extremely fascinating. Definitely gonna take that information on midpoint sleep into
Yeah.
consideration.
Come,
Again.
come see us down the street. We're still working on a lot of that sleep work too.
Awesome. Thanks.
Yep.
Right. Next up, we have two folks who are tasked with helping to ensure our university is healthy and have demonstrated impressive leadership in that effort. We have Jessica Hughes Wagner, Director of Strategic Initiatives at UT Healthyhorns. In her new role, Jessica provides strategic leadership surrounding the entire Healthy Horns portfolio, which includes University Health Services, Center for Mental Health Counseling, and the Longhorn Wellness Center. She was previously Assistant Director at the Center for Health Communication, a joint endeavor of the Moody College of Communication and Dell Medical School. And we also have Katie Reed, Executive Director for the Longhorn Wellness Center, where she leads the Longhorn Wellness Center, the Center for Students in Recovery and Shift. She holds a Master of Public Health and a Master of Social Work from New Mexico State University. Katie's professional interests include health communication, public health methods to improve mental health, and health equity. Please welcome Jessica and Katie.
Thank you, Jay. I think, Katie, are you going to get our slides queued up and then I'll just get us started? Well, it's fun to be a presenter on one of these seminar series. I've attended a lot of them as a listener, so we'll get a little time to share today. And also fun as part of the steering committee for the Public Health Coalition, both in my previous role at the Center for Health Com, where I worked with Catherine, and now my current role. Really thinking about how all the ways public health work is happening on campus and how much this coalition stands to bring us all together in a room to talk about that. So one of the great ways public health is happening on campus is through the Longhorn Wellness Center. So that's what Katie and I want to tell you about today. Katie oversees that area. So she's going to tell y'all the most about what they're working on, specifically one project, but I'm going to give y'all an overview. And, the goal of the Public Health Coalition, one of the goals is to foster interdisciplinary public health community and collaboration at UT through research, education, and community impact. And that's really reflected in the mission of Longhorn Wellness Center. And so, Katie, if you want to scoot us ahead to the next slide, I can give you all a quick overview. I want to tell you the purpose of the Longhorn Wellness Center, the framework for action, how they really approach doing public health work here on campus, some of the focus areas and programs, student training. We have students who are training to be public health professionals, tons of them coming through the Longhorn Wellness Center. So I think there's great possibility for partnership with the coalition long term in that regard. And then, like I mentioned, we'll have time to tell you just about one project that Katie's been leading. And so the Longhorn Wellness Center is part of an umbrella organization you'll maybe seen on posters and hand washing signs around campus, Healthyhorns, which encompasses University Health Services, which is the medical clinic, Counseling and Mental Health Center, which is our counseling center, of course, and then Longhorn Wellness Center, which I really think of as the like mini public health department within UT. And you can see in the next slide how the Longhorn Wellness Center is set up for action. Now, you know, in public health, we love a logic model, right? And so this is a way of representing how Longhorn Wellness Center does their work. And I think I want to call attention to the fact that in this purple area, how Longhorn Wellness Center is doing their work. They're operating across levels of ecological framework. So we're not talking just about health education. We're not talking just about posters about hand washing, like I brought up. It's really across the spectrum of, yes, there is individual level work, but also organizational level work, and then communication and policy work. So kind of across the spectrum of how we can influence change on campus, the team is doing that. There are 13 public health professionals. I think that's right, Katie. You can correct me if I got that wrong. Doing this work, and for a campus our size, that's a lot of horsepower per person. Longhorn Wellness Center is aiming to, yes, have students be healthier, of course, but we want the environment to have conditions that's healthier for everyone. We want everyone on campus, not just Longhorn Wellness Center, to have capacity to promote health. So in the college schools and units, what are the ways in which those places can be health promoting as well? We want students to feel increased connectivity to their community. We know that's really important to health outcomes. So those are some of the results the programs and services are aiming to drive. And then the long-term impact is, of course, that well-being is considered in everything we do on campus. If there's a new vendor going into the Union food court, we want public health to be at the center of that decision, for example. Of course, student health outcomes, but then also thinking about, we're doing this work in a very specific place, right, on a college campus. And so student success, persistence, retention, all of those things, we know being well is central to students being able to do that. So this is how Longhorn Wellness Center thinks of the work that they do. And so let's see, what do we have next? Here are some of the focus areas. Katie's team does a lot of data collection, both primary and secondary, to make sure their work they're doing is informed by evidence, and they're focusing on areas we know are of highest need for students. And so that team of 13 people is doing program services across these areas. And we would love to be able to have a seminar to tell you about the work happening within each of these areas. But for the purposes of today, we're going to focus on just one. And before I turn it over to Katie, I want to tell y'all just briefly about some of the student training and volunteer opportunities. These are folks who are wanting to have careers in public health. And so thinking about what can we do to give outside of the classroom, or some of these experiences are inside the classroom. They're 4-credit courses to help train up the public health workforce. And so the Longhorn Share Project is a peer support program for social and emotional wellness. Longhorn Wellness peer educators, we really think about that group as getting like a public health 101. Jay, I'm just having this thought in the moment. All the work you're doing on the interdisciplinary public health degree, I wonder if you'd want to see the curriculum for the Longhorn Wellness peer educators and kind of see where some connections are there.
Oh, I'd love that.
Yeah. And then of course we employ a lot of students through jobs and internships as well. So the training the public health workforce is something that's really central to the Longhorn Wellness Center, and I think overlaps well with coalition goals as well. So Katie really runs the show, so I'm going to turn it over to her to tell you all about a project that she's been working on.
Yeah, thanks, Jessica. It was a great overview of the Longhorn Wellness Center. So I want to tell you about, I was thinking about like what sort of project or aspect of Longhorn Wellness Center might be most interesting to this group. And I kind of narrowed in on this collaborative project that we're working on. And I wanted to present this because it's it's a unique way of going about change making. So I thought the process might be perhaps even more interesting because I don't have necessarily particular outcomes to share. I really want to share the process that we're using. So UT Austin is participating with 16 other institutions. So there's 17 of us total in Texas. We're part of a higher education collaborative for well-being that is run through ANEW, which stands for Action Network for Equitable Well-Being. And that group is made up of folks from around the country who have jobs kind of like mine, who on a volunteer basis run this network. And their job is to, propel universities and get them through this 22-month-long process to learn this new change-making pathway. So the idea is each university chooses a subpopulation of students who are disproportionately struggling. And we utilize, how do we know who's disproportionately struggling? Well, first we take a look at all the data that's available to us. So when we determined which subpopulation we were going to choose, we looked at counseling center data, who's utilizing, who's not utilizing the counseling center. We looked at our National College Health Assessment. We looked at we were starting to hone in on the fact that maybe we were going to be looking at low SES students. So we started looking at our UT for Me program at UT Austin, captures that group, sort of Pell eligible students. What data did we have available to show us, are these students disproportionately struggling? So we kind of honed in that this was going to be our subpopulation. Now, at other institutions outside of Texas who have participated in this process, they have a larger group of students that they might be able to choose from that are disproportionately struggling. So we were limited to SB 17 allowable subpopulations, as were all the other schools that are participating in this project in Texas. Some schools are choosing first-gen students, some are choosing students with disabilities, but there was kind of that limitation there that was put on us. So the process that we do is we're doing rapid assessment constantly throughout the year. So there's a survey instrument called the Wellbeing Improvement Survey for Higher Education Settings, WISHES, which is really pulling together different survey tools about health and well-being into one instrument. We conduct this twice per semester for all, and we're partnering particularly with the College of Natural Sciences. It was too big a population for us to choose all low-income students at UT Austin, and so we narrowed down. Our first cut was to say the College of Natural Sciences students. And we had some data to show that those students in that kind of hard science degree do have some particular health outcomes. And even within that group, then we have our low SES students. So we do this well-being, this WISHES survey. We launch it twice. We're actually right in the middle of not right in the middle, we're right at the beginning of our second administration this semester. And then we're conducting empathy interviews with students, faculty, and staff. And I'll tell you a little bit more about those in just a minute. But this is the change-making pathway. It's a terrible slide, but I didn't want to remake this thing that was provided to us. Essentially, we are in this October 2024 to May 2025. The idea is that we deeply get to know our population through several administrations of the survey and through empathy interviews before we start to generate solutions. So in this process, we all are jumping to like, well, what about this? We could do this. If we did this, we could tweak this, we could do this. And our coaches through and new are constantly saying, stop it, stop it. Don't start to generate ideas, because then you're going to be going down this path that may not be the right path. That may not be the solution that you need to be going down. And one of the most important aspects of this is our empathy interviews. And empathy interviews, we've conducted 15 with students who are part of the population and 15 with faculty and staff. These are different from a regular sort of research interview where we have a protocol. Here's all the questions we're asking. These are really about sitting down with someone across the table and saying, what's going on in your life? Tell us a little bit more about areas where you're struggling. And then based on that, going a little bit deeper and then taking the conversation over in this direction and then taking it over in this direction. So all of those interviews look a little bit different. It's been really interesting what has come out in those interviews. I talked to a faculty member who, it was really clear to me the connection that he had with his own personal life and his own personal experience in struggling when he was a college student, and how that has put him in a position to say, I'm going to do it differently, which has had really wide impact on our campus. So we're able to really kind of hone in more on like, what are the aspects of the curriculum? What are the aspects of, the College of Natural Sciences and this particular subpopulation? And where might we eventually, not right now, but eventually come to an idea of a change that we could implement? And then there's a rapid test, iterate. Is this working? Is it not? Because we're constantly administering this wishes survey. Here's some current insight. Again, this is super preliminary because at this point, this is just our first administration of the wishes. So we've done 3 so far, November, February, and April. We're in the midst of one right now. This over here is just some means from our first round. So not UT for me are our Pell eligible students. Non-UT for me are the rest of the general College of Natural Sciences population. In general, what we're seeing is that UT for me students are less likely to identify that a professor cares about them. They're less likely to identify they're more likely to identify that they feel left out, that they lack companionship, and that they feel a sense of belonging. So those are some of the themes. And we had, 45 or 50 questions that we looked at. And again, we're just comparing means at this point. But we noticed differences across all of them. Some other current insight that came out of our first round of empathy interviews, which we did last semester, our subpopulation seems to be, again, more poorly on this one was from wishes in general, more poorly on indicators of well-being. Being part of something, this started to come out in our empathy interviews for our students who were part of the subpopulation. If they were part of anything, even one thing, a club, a group, or even a class project, they had a greater sense of belonging. One thing that came out is that the College of Natural Sciences curriculum is really complex. It really is hard to figure out and navigate. And one thing that came up more than once is that in CNS in particular, students cannot transfer in math or science credits. So we've, you can't come in to CNS with a math credit from ACC or from another school. You just have to retake it here. So we know Austin's expensive. We all feel that. While we have this Texas Advance commitment and are paying for student tuition, whose parents make under a certain threshold, that doesn't necessarily pay for their some of their basic needs. Campus jobs don't pay as well as jobs in the community, and they don't have hours that are as conducive to a student's schedule. So students are going to be going back and forth just in order to, pay rent. There are resources that are available for our subpopulation, things like the outpost and food and scholarships. They're spread out, they're difficult to access. You kind of have to be in the know to know how to get to these things. And one thing that we learned is that some faculty really, really care about student well-being. This is something they're deeply passionate about. And they are often the ones who are spending an enormous amount of time outside the classroom, investing in student health and well-being and helping students go a long way. And they aren't compensated. They're not acknowledged for this. This isn't part of their tenure package. So those are all interesting things that we've learned as we've gone about this. Again, we're at this stage where we are, actually Friday, we're going to be putting together our second round of empathy interview themes. And then in May, we're getting together with all the other campuses in Denton, with our ANU coaches, and kind of figuring out what the next step is for each of us. So we're just at the beginning of this 2-year journey, and I just wanted to share the process with y'all a little bit. Don't be strangers. We're on the first floor of the Student Services building. You can tell because when you look in that window there, there's moss on the wall. It's live moss. So let me stop sharing my screen here.